thank you so much for taking the time to participate in our STARR Coalition Mental Health Awareness Month Advocacy Roundtable. So my name is Mallory Mercer. For those of you who don't know me, I serve as the Director of Advocacy and Community Engagement for the STARR Coalition. And this event has been months in the making, and our advocacy board thought that this would be a really wonderful opportunity to celebrate Mental Health Awareness Month, while also continuing to grow our relationships between mental health advocacy groups and industry partners. So our last call, I was very inspired. One of our members said it best. They said that this is not a we-them conversation, but an us conversation. And we truly hope that events like this just reinforce that dialogue and allow us to create better futures for individuals living with mental illness through clinical research trials and community partnerships. I want to take a second to say thank you to our entire advocacy board. So many of you showed up today through your busy schedules, and we really appreciate that. And a special thank you to our three co-hosts who are about to introduce themselves. I would love to let them do that. And then I know all of us have a really packed month and a really packed day. And so I know we're already pushing time a little bit. So hopefully this will go smoothly from here on out. And I just want to thank you all on behalf of Carol, Erica, and myself, because we all just really appreciate your time and effort. So let's start I'll do a kind of a review for all of you really quick. So the meeting is recorded. Hopefully, if you are late, you can watch it later or share it with your teammates who were not able to be here today. We did have pre-submitted questions, so we'll go through those first. And then if we have time at the end, we'll open the floor for anyone else to ask questions. So let's start by asking our co-hosts to introduce themselves. We'll start with Dr. Linda Gargan.
Thanks, Mallory, and welcome to everyone who's joined us today. I'm Linda Gargan. I am the Executive Director for the National Federation of Families. We are a national advocacy organization that supports families who have children who are experiencing mental health and or substance use challenges. We have about 120 chapters across the country. And at this very moment, we are celebrating Children's Mental Health Acceptance Week. So thanks for having me.
Thank you for being here during your very busy week. Greg, would you like to go next?
Sure. Yeah. Hi, everyone. I'm Greg Hanch, Executive Director of NAMI Texas. If you're not familiar with NAMI, it stands for the National Alliance on Mental Illness. We are the nation's largest grassroots network dedicated to building better lives for the millions of Americans affected by mental illness. NAMI has hundreds of chapters around the country, 27 of them here in Texas. I'm with the NAMI state organization, NAMI Texas, and we've been around since 1984. We have about 1,700 members made up primarily of individuals and families whose lives have been affected by mental illness. And we really do three things. We do education programming around mental health. We do support groups, and we do advocacy work. And advocacy has always been a big focus of what I've done in my time, my 10 years with NAMI Texas. A lot of time spent at the Texas State Capitol trying to push for better mental health laws in Texas. I look forward to talking with you about that here today.
Thanks for being here, Greg. And finally, we have Steve Michio.
Hi, I'm Steve Michio. I'm the CEO of People USA, and we are a peer-run organization that provides a host of crisis services from mobile to crisis stabilization and peer respite houses, in addition to all the other peer services that we provide in care coordination. And we're very in tune and working in the forensic and criminal justice world too. So yeah, I'm really happy to be here. Thanks.
All right, well, let's get started with some questions that we have had submitted from some of our partners. So as we go through these questions, Linda, Greg, Steve, if you want to jump in, just let me know. So our first question, specifically, I'll point this first one to Greg. Like I said, Linda or Steve, if you want to jump in afterwards, let me know. But someone wants to know, how do you as an organization feel about your clients being involved in clinical research?
Thanks, Mallory. I feel cautiously optimistic about our members being involved in clinical research. We know that being involved in a clinical trial has the possibility of improving a person's medical condition. We know that when people are in clinical trials, they receive medical care from professionals that have expertise in providing treatment. We know that for participants in clinical trials, they get the opportunity to play an active role in their health care. They may, in fact, get other extra services that they may not get going to the community mental health center or seeking care at an inpatient hospital setting. So sometimes there are some added benefits to engagement in clinical trials that people wouldn't get otherwise. I'm also, pleased when our folks participate in clinical trials because we know that clinical trial participation is essential to helping scientists find new treatments. And that can have a ripple effect on the population that we serve. So it's something that we strongly support, and we encourage our people to look at what opportunities there may be for them, to participate in clinical trials for the betterment of their own lives, as well as for the betterment of other people's lives who may have had similar experiences to them. But I say cautiously optimistic because we know that not all clinical trials or all clinical research sites are made equally. And in some settings, people receive better care than in other settings. So we want to make sure that if our people are participating in clinical trials, that they're participating at sites that are ethical, that hold up people's rights, that make people feel well cared for and make sure that they are well cared for, and that those clinical research sites are really putting the individual at the center of the care that is being provided to them, that the number one priority is protecting and ensuring that participants in clinical trials are getting what they need and getting access to the right resources. So that's a consideration for us, and we always encourage our members who are participating in clinical trials to do their due diligence in making sure that they're receiving care and participating in the clinical trial in a setting that checks all of those boxes for us.
I think that's a great answer and probably echoed with a lot of our other advocates as well. So I appreciate your answer. Steve or Linda, do you care to answer that question?
I mean, I would echo that. And in addition, the best consumer is the educated consumer. So, I always think of it as a customer base. You want clarity on what the research is for, what's it about, what are the possible, pitfalls that there may be. Again, protecting the individuals that are, signing up for these. A lot of times we've had at our organization, people come to us and say they asked if we wanted to be in a new medicine clinical trial, and we will jump in as an advocacy organization, take a look at what this is, and work with them and seeing if that's the best decision for them.
I think that's great. We'll move on to our next question. I'll point this one at Dr. Gargan. So one of our sites wanted to know, how can research get involved in advocacy work to build lasting partnerships?
That's a really good question. I think if we can set up a system or an infrastructure or whatever where our research partners are partnering with the advocacy organizations across the country, in their communities, however they can get involved, I think it's very important. We find that when we're working with research partners that we assume they understand and are well-versed in the needs of families and even the language that needs to be utilized with families. And they sometimes are not. So I think if we can continue to create these very strong partnerships, I think it will only make research better. And honestly, joining STARR is a great way for folks to begin to develop those relationships, or other organizations like this. And I do believe that we will have, I think we will have more families who are interested and more trusting of research if we can do this. And I think our researchers will be very well informed about the needs of families in this work.
That's great. And then, Greg, I also wanted to get from your perspective different ways that advocacy can get involved.
Sure. Yeah. So I think there are a number of ways for advocacy and research to work together. I will say, coming from the advocacy side, it's been fairly infrequent that we've heard from the research arm of this ecosystem. And I had shared that, with Mallory recently, that as interested as we are in research, and as long as I've been involved with STARR Coalition as a founding member, I can count on, maybe two hands how many times I've heard from clinical research sites saying, hey, we want to learn about NAMI. We'd like to know what your priorities are. It just doesn't happen that much, but it does happen. And actually, someone on this call who's from the research side recently reached out to me just to learn more about my organization, and we're going to meet next month. So we appreciate that. We're looking for synergy like that. It's easy enough to become a member of NAMI. We're a membership organization. Anyone can join. It's not just restricted to individuals and families affected by mental illness, although that's central to our membership. It's really open to anyone who's a mental health stakeholder who wants to be involved in the cause of mental health. So I encourage membership in NAMI, signing up for newsletters, following us on social media, engaging with us on social media. We always appreciate when STARR Coalition, shares one of our posts or gives us a shout out. That means a lot. You can join your local mental health coalition. There's oftentimes in state capitals a coalition of mental health organizations that are working together to advance good legislation on the topic of mental health. Right here in Texas, we have a bill going through our legislature that would create a Texas Mental Health and Brain Research Institute, which I think is of mutual interest probably to groups like NAMI as well as to the research community. So you can get involved in initiatives like that, by becoming part of the Mental Health Coalition. And just finally, to circle back around my first point is just reaching out, finding out what your local advocacy organization's needs and priorities are, seeing what you can do to support them. You can participate in their NAMI Walk, which is our signature event. That's possibly what NAMI is best known for. You can set up an exhibitor table at the NAMI conference, present a workshop at the conference, and co-host a meeting in the community between NAMI and a research site to discuss advocacy and discuss participation in research and how we can work together towards common goals.
That's great. Steve, I know you're New York based, but do you have any insight on people that are in New York or near you guys on how they can get involved in your advocacy efforts and partner with you?
Yeah, I could probably let Hamali speak to that, but we are, we're doing more than we ever did, especially this month, and it's great. So we're asking for a lot of participation. Hamali?
Yeah, we are certainly, our service delivery is in the Hudson Valley region in New York, but we do a lot of consulting work all over the United States. And so I think the partnership could be really meaningful. I think what Greg said, I would just echo that in all the different pockets of the community. But, our service area, our delivery is in the Mid-Hudson Valley. But I do want to say that we consult to build some of these programs all over the U.S. And so I could see those same local community partnerships really, really being meaningful. So I think it starts on that local level and partnering with an organization that is doing a lot of that work in that local space.
Thank you, Hamali. So this question I thought was really interesting because every time that Erica and I bring in a new site or a new sponsor, they want data. They're scientists. So someone asked, they always ask, what's the data on working with this advocacy organization? And I always say, there isn't any. It's just the right thing to do. So one site asked if we could speak to the importance of funding other types of research, such as community research and efficacy of care, so that data can be shared and industry may see the overall benefit of working with these groups. So I think this question, I'll start with Linda, and then I'm sure, Steve, you'll want to answer as well.
Well, Mallory, this is sort of my platform. Quantitative data is nice and counting things is nice, but at some point we have got to look at qualitative data. There's relational data. There is, a lot of our work is around family peer specialists, and we are begging researchers to take this on because it has funding implications, it has quality of life implications, and folks are hesitant to do this because it's messy. And we know it's messy, and we embrace that. And we feel like working with advocacy organizations would be such a plus for someone who wanted to really focus on, like I know someone gave the example of respite care, incredibly important. And yet, does it make a difference? Families will tell you it does, but does it make enough difference that we could publish something about it? Well, we haven't really researched it. So we are huge proponents of this very important qualitative approach, not taking anything away from the quantitative data that we know lots of scientists really like to get their teeth in. But we're hoping that we will see a push and a focus from some researchers to really dig into this, and let's get some information published about the importance of this very, very important work.
That's great, Dr. Gargan. And Steve, I would love for you to answer this as well.
Sure. As an organization, we saw locally the difference we were making in the people we were serving. But it came down to, is this data valid and reliable, that we were seeing, and are we asking the right questions? Are we looking at all the variables of what's making things work for individuals? So we ourselves are investing in research now because how do you know? I have these great respites and we see these great outcomes and we know that we're saving dollars. We have that evidence. But how do we know we're improving the quality of life of the individual? Even though we do, 8 dimensions of wellness research and from our perspective, having an outside third-party research organization come in and put us under the microscope and look at all those variables of what's working, what's not working, it helps us to become a better organization, but it also helps us to understand if we are making a difference or not. And if we have to tweak something, change something, that research is going to kind of tell us what we need to do. So it's extremely important.
Thank you. Our next question is for Greg. So you spoke earlier about you're cautiously optimistic about working with research. So is your attitude towards research from a personal experience with a client or a loved one? Can you speak to that a little bit?
I sure can. So for me, it's not, knowing someone. I can't think of people I know in my life, who have participated in clinical research and who have told me about it. But I am aware that there are some big myths and stereotypes about clinical research that have been in the media, that, you might see it in a movie or a TV show, that it's portrayed in a not very personalized way, and that people are treated, as subjects or as a number rather than, recognizing them for their inherent worth and dignity as human beings. So those stereotypes and myths are out there about clinical research, and that, probably was how I thought about clinical research before I learned more about it. And the STARR Coalition has played a big role in educating me as a patient and family advocate about the reality of clinical research. And so, I think we have a responsibility as mental health stakeholders and people whose lives have been affected by mental illness, to set the record straight, educate, not just the sort of the grass tops of the organizations, the executive directors, the program directors, the staff, but also our volunteers and our members. We need to make sure that the right information about clinical research and clinical trials trickles down to people who are most intimately and personally connected to how the clinical trial research system works, and those are the participants. So I think we have a role to play in that space, and we intend to do more there.
Thank you. Our next question is for Dr. Gargan. So someone wants to know, what are the barriers that you see with working with industry partners?
I think Greg hit it when he first started talking about, we just don't hear from them the way we want to. I think it's as much about us beginning to get to know one another better. And I think forums like this is a good way to do that. Some of the barriers that we see, I can only speak from this side of the table. Our families, again, have heard the urban legends, the myths, all of the failed clinical research stories. And they rarely hear the stories about where this has been successful and helpful. So we definitely need more information out there. I know the groups that we're working with from the Federation, we're trying to make sure we are getting information out to the communities at the grassroots level. But then we've also got to figure out how to make ourselves better known to the industry and how to really educate the industry about how helpful we can be. I don't think we've done a great job of that. We're trying to figure that out amongst ourselves. And I think it's just something we have got to continue to work on if we want to develop some solid partnerships, which I think would be so helpful for our families.
That's great. And Steve, I want to get your input on that. I know even in the last probably 6 months, I have introduced you to so many different people, and you're going to all these conferences and you're making these great impressions on everyone. And despite that, I'm sure you're seeing barriers as well. So could you maybe speak to the barriers that you guys are seeing with your model?
The biggest barrier is fear, because it's fear of the unknown. And so when people hear about what we do, the automatic go-to for people is, well, what if? What if they hurt themselves? What if they try to kill themselves? What if they hurt others? What if they become violent? Everything you think of a negative is what we hear constantly. And, our approach is, well, what if they get something they never got out of this? What if they improve their quality of life? What if, that's how we operate from. We operate from a strength-based positive approach to everyone we work with. So, when you don't have a bevy of research that comes out and shows people that efficacy and efficiency and value of what we do, you get the fear factor. And even to this day, 24 years we've had respites open, and we still get that same reaction, even from the same community that we're operating in for all those years, because people don't fully wrap their heads around it. And I also have learned in life that people forget very fast, and that's why I think history repeats itself, is because if you're not out there at the forefront, constantly educating, working with, and following up, you get forgotten. And so the job is to keep that going. And yeah, our marketing as a mental health, behavioral health society has been horrible. We're behavioral health people. We're not, marketers. And so now, turning to that is important, but again, having the data, the information to back it up, is just as important. So there's a lot of work to do, but we're doing it.
Yeah, I specifically thought of you with the question about other types of research, because all those what if questions could be answered if we did some community research, and would make people feel a lot less fear surrounding respite care. This question is for Greg. So,
before you jump, Mel, I just wanted to throw something in there as far as like working with the peers. We were at a conference last week, and I spoke with a whole bunch of different people from different community mental health centers, and specifically about, do they have peers working within their organizations? And a few of them, obviously did, but one woman said that they could not run their operation without the peer help. And they said that the peers were their most committed, their most passionate. They had the fewest call out days. They worked the longest hours, that they were their most sort of passionate people that were working there, because it helped them as well as helping the others. So I just wanted to add that, because I wish we did have numbers, but the fact that, like, someone said that to me, and I wish I'd recorded it, but it's such a profound response, and I think needs to be said.
Yeah, thank you.
Thank you.
Jumping in, I think that's very important to note, and I wish you would have recorded it, Erica. Greg, do you feel informed about how medications are FDA approved and why volunteers are necessary? And if not, can you tell us how industry could maybe lead that conversation?
Yeah, I think I'm, fairly well informed about FDA approval processes. I certainly have an understanding that, clinical research trial participants are essential, to bringing medications to market. So absolutely, that's a big reason why we, encourage responsible participation in clinical research, is because new medications, new treatments will not become available unless people engage in the clinical trial research process. And I suspect many of our members, are in a similar place as I in having that basic level of understanding, not the intricacies of the process, but just generally that there are multiple phases of trials and a review process at the FDA, a number of other steps along the way. But so they know, but a lot of our folks also don't know. They probably, have very little understanding of how that works. So, I think from that perspective, it's important to raise that level of awareness that they are a critical link in the chain of new treatments being made available. And then secondly, from an advocacy perspective, NAMI, has a history of weighing in on the FDA approval process and issues that may exist with FDA policy and practice, as well as congressional action or the lack thereof on things like funding for the National Institute of Mental Health, on Prescription Drug User Fee Act. The part of that whole infrastructure of the FDA approval process, NAMI advocates in that space. And the way that NAMI advocates is, very much focused on leveraging lived experience. It's just as important for Congress to hear from the NAMI lobbyists in DC as it is to hear from individuals and families who are personally affected by decisions that are made on the congressional level. So I think we need to educate our folks on that system of drug approval so that they can be more effective policy advocates.
That's a great answer, Greg. And I think you probably have a very unique position and that you understand that a little bit more, and you've been involved with the STARR for so long. I'm curious, Linda and Steve, do you guys feel like you're well informed when you're talking to researchers on what that process is like, or how could they maybe explain that better to you so you understand it?
Yeah,
go ahead, please. So I would just say you don't know what you don't know. Do I think I am fairly well informed? I would say tepidly yes. Certainly I could be much better informed, as I'm sure many people could. I think this question about can industry lead a conversation, if by industry we mean the research industry, I would say they can lead better conversations on any of these things if they're partnering hand in hand with some advocacy organizations, because the language and verbiage that the industry uses is somewhat foreign. I mean, if you've ever tried to read the label on a prescription, it's just enough to make you want to take something else instead because it's so complicated. And being able to explain that to families, and oh my goodness, try to explain it to young people, it's very difficult. So I think, yes, I know somewhat about this FDA approval process. I would love to see it in family-friendly language so that we would all understand it better.
Yeah, that's exactly where I was going. Is you read the formularies on prescription medication, and it's just ridiculous. And I do understand the FDA process pretty well because I dove into it to understand it, and it's difficult. It's difficult to navigate, to understand, and of the whys. And I also think there's researchers are just that, researchers, but they often need help of like an advocacy organization or common folk to help them with the nomenclature and understanding the environment of what people are experiencing. They don't always go back into the traumas of people or the lived experience of people, and you throw research at it and you come out wondering even more because you didn't understand where it all started. And research doesn't always do that. So I think there has to be a different look at how research is done, especially in behavioral health, to get better outcomes in the research itself.
I think those are all great answers. And we actually had 3 different questions about understanding the FDA process, understanding the informed consent process, and the IRB protections. And so I think probably all of those answers kind of answer the same thing. So I think what we're hearing is we just need better language, maybe more communication with our advocates and our researchers to explain that. But you're not only explaining it to advocates, you're explaining it to the people that they serve. So the families, the people that are utilizing the medication. So I would encourage whoever sent all of those questions, they're great questions. And I would encourage you to get connected with one of these advocacy groups and, work with them on that. Because that's a great question and those are great points.
Mallory, could I just throw in one thing here because this one is so important in our work. We all know that the language that comes out is very sterile and it's done in a vacuum. There are such cultural implications for this language also, and we cannot forget that. And what sounds perfectly clear in Connecticut does not sound perfectly clear in Appalachia. So, if we really want to do some cross-sectional clinical research, we've got to get serious about who it is we're trying to reach.
Thank you. That is yes, cultural awareness is super important. And it's hard. It takes a lot of time and effort to understand your target audience. So thank you for that, Dr. Gargan. This one, yes, please, Amy.
Well, it's kind of interesting from the site perspective. I'll tell you that, part of all of this stuff with the FDA and the reasons for the sterile, so to speak, verbiage, a lot of it has to do because we live in a very litigious society. So I often think that a lot of things are covered up because of that. I don't know. But some very good points have been brought up here. So this has been really fascinating. I appreciate all of this information. I just wanted to share that one piece about it being a litigious society that we belong to. And so I think that's a lot of the reasons why it's hard to muddle through all of this and get through to the people that really need it. I don't know.
And I think that's an important perspective, Amy. We have to think there's a lot of different things that go on behind the scenes, and a lot of the various reasons that sites and sponsors do things the way they do are probably not in their own control. So it's good that we have these conversations so that we can face them together. Our next question for Dr. Gargan is, what types of educational materials or outreach would assist educating about research as a viable option to those with mental health conditions?
A couple of words, and we say these all the time: family friendly, family friendly, family friendly. We need to work hand in hand with our research partners to develop information that our families, first of all, will find valuable, and secondly, that they can read. And we are working currently with a couple of wonderful partners to do that. And it's amazing what we learn from that work. Just the language is so different. We need information that is easily digestible. Videos are wonderful. Very short video clips are wonderful. Anything that's bulleted. Our families are so busy, and they typically are dealing with significant crises either in their lives or the lives of their children. So they don't have time to read a lot of information. So things that are written in plain, family-friendly language that is easily digestible is what we encourage. It's what we do, and it's what we encourage with our partners.
That's great. Greg, I want to give you a chance to answer that question as well, because I know NAMI has a ton of educational materials, and you guys probably put a lot of work into that. So how do you think that could be reversed and you could work with industry to create those materials?
Yeah, I think we could do a much better job collaborating with the research industry on providing educational materials about how the research process works and about the benefits of participating in clinical trials and what the protections are for people who are in clinical trials. That sort of information, I think, is very valuable. And we have done, a fair amount of that over the years. When National Institute of Mental Health had its outreach partnership program, we were part of that. And that was all about educating, our membership about what research is and how that system works. But that program no longer exists. However, we still, and as a member of the STARR, in large part, we still do what we can to get the word out about research. I think, in terms of what materials are most helpful, I think, I would echo a lot of what Dr. Gargan said, family-friendly materials, engaging materials, experimenting with mediums beyond just the written word, video materials, testimonials. I think a testimonial is one of the best things that you can provide, putting a face on research and the benefits of participating in research. I think that goes a long way. And then, in a state like Texas, where we have 30 million people, we have, close to a third of them are primarily Spanish speaking, and then just about every, cultural, ethnic, linguistic group, you can think of, with a very diverse state. We just need more options in terms of being able to reach those populations. So translated materials, culturally competent materials are, I think, essential to that outreach work.
Thank you, Greg. And in the interest of time, so I can leave time for us to open questions, I'm going to skip a few, and those questions I will send to the group. But the last question that I think is very important, and probably a lot of you want to know, someone asked, if I were to approach your organization to share about a clinical trial my site was enrolling for, how can I best break the ice? How does that conversation start on the right track? So I'll start with Steve, and then I'll give Linda an opportunity, and then Greg, you as well. I think this is probably a question that all of us should answer.
Yeah, with us, it's easy. You contact me and tell me what you're trying to do, what you need to do, and how we can possibly work together. And so I think, again, educating me and my team is best for us to help make the decision on whether we go forward with it or not. So, information.
I agree with Steve. I would say if you are coming to me, it's probably a good idea to get on our website for a minute. So when you come to me, a little bit about us and what our focus is. And then we love having conversations about partnering. So I would encourage anyone who is looking for partners who are supporting families and their children to definitely get in touch. And just like Steve said, we would love to talk with you.
I echo those comments and would add, we do hear from researchers in Texas, often, non-pharmacological research, other types of mental health interventions that they're wanting to study at some medical school, and they're saying, hey, can NAMI help us spread the word about this research study that we're doing? And frankly, a lot of the time it slips through the cracks, or it's just not a priority. So I think when it's presented as such a self-interested, help us get the word, help us make our study a success, sometimes it doesn't quite land for us. And we would much rather someone reach out to us and ask about what we're working on, ask how they can support us, and then as part of that conversation, share, what they're working on and seeing where there might be some synergy. So as for it to not be so one-sided, a researcher who is looking for clinical trial participants, and that is their motive for reaching out to you. That doesn't always, sit well with us. And then finally, whenever you can, because we're a state organization, running your requests for research participation through the national organization, when it has the stamp of approval from NAMI National, it can go much further than just reaching out on a local or state level.
I think all of those are great points. And even I think sometimes things can get misconstrued when people don't necessarily know how to make those connections. It can be really scary because I think industry understands the hesitancy there. And so using the STARR or, reaching out to Steve or Linda or Greg or someone who understands a little bit more about the relationships that are going on, I think don't be afraid to reach out, because if the language bothers them, they'll correct you, but don't let that stop you from making those very important connections, because this whole community the STARR community at least, is very welcoming, and they're very willing to mentor you and let you know. I know I started 2 years ago, and there are so many people that were willing to step in and say, this is the correct language to use, and it's just been so amazing. So thank you guys for being on this roundtable. I know we have about 6 minutes left, so I would love to open the floor and allow any questions before we go. So the floor is open. If anyone would like to ask any questions, you can take yourself off of mute.
I actually just had a comment because I love the conversation about how do you connect. And I think it's so important. I'm glad to hear you guys say that, but it's so important for research to be a part of the healthcare ecosystem. And it's not a recruitment tool. It is a process of give and take. There's a lot of things that researchers can do to help support advocacy in many ways other than just monetary. I think there's a lot of things that we can do outside of just the research realm to help be a part of the solution of some of the issues within the communities. So I'm glad you guys brought that up, because I think it's important for researchers to know that, hey, if you want to be a part of this ecosystem, healthcare ecosystem, which advocacy is one of those, we've got to step up and just not talk about research, but how are ways that we can help in other ways. So, I've enjoyed being on this call. You guys are a wealth and breadth of information and passion. I love to see that. So thanks for inviting me on.
We have a couple of sites on this call that are very engaged in their communities and do a lot of outreach with their local nonprofits. Maybe Amy, if you can just jump in and share a couple of things that CNS Healthcare does with your outreach, just to show everybody, the different options basically?
Well, first of all, we're all in this together. And I think that's the main thing, is that we're all in this from our hearts. I mean, obviously everybody works because you need, to pay bills and what have you, but we do this because we really love this, just like I think everybody in this on this chat. There's a passion there. So we have community liaisons at our sites, and we also do tons of community outreach, tons and tons. And we're finding actually that the pharma sponsors are requesting that we do a lot more of this than has ever been done in the past. I've been doing this with this company now for a little over 22 years, and I have seen it swing to the other side. Like now we have to they ask us, and they limit us on some of our studies that we're doing for our diversity. Like they only let us put in certain amounts of ethnic groups into each of our studies, which is really good. So you as a site have to have the ability to go out there and to reach those populations of people so that you can get them in. It's not all about just, the worried well that are coming into clinical trials anymore. So that's a good thing. But we try and do as much as we can. We try to partner with each of the local advocacy groups in our areas, and we do a lot of sharing because a lot of people that come in the door for us don't qualify for any of the clinical research trials that we have. So we like to make sure we have a relationship that we can refer them down to someone in the community instead of just leaving them hanging when they come in and they try to get into one of our studies and they don't meet the inclusion or exclusion criteria to get in. We just don't want to leave them hanging. Again, we're all in this together. So better communities all the way around, better people, better life. I don't know.
Thank you, Amy. That was so great. And I know we have a lot of sites within our coalition that are working. They're doing best practices. They're working with Erica and I. They're working with NAMI and People USA and the National Federation of Families. And so that's very encouraging. So, if any of you have any questions, I encourage you to reach out to Erica or myself and we can connect you with any of these advocacy groups. I know they would be very delighted to speak with you and teach you more about how to work with advocacy. They'd be interested to hear more about research. So I don't want to take anyone else's time. I know that this is a really busy week, but I just want to thank you very, very much on behalf of the STARR Coalition and our advocacy board for being here today and participating.